Hello, everyone. This is Betsy Wurzel, host of Chatting with Betsy on Passionate World Talk Radio. Jeanne White is the producer, and I'm having a chat by myself today because I had something festering in me that I just had to do a show about by myself, and that is healthcare. Now, I know I've talked about healthcare in the past, and for those of you who are listening in Europe and Canada, here in the United States, we do not have universal health care. So when we go to a hospital, our insurance pays whatever they're going to pay, and we have to pay the rest. We also pay for doctor visits here and medicine, so it's different from other countries. What has happened with me is that I had to go on the so-called Affordable Health Care Act. I live in New Jersey. New Jersey's health care, affordable health care, is not modeled after what it was originally. I picked the cheaper insurance company, and I do pay more because I have a PPO and not an HMO. So you pay a little more for that. Excuse me. Now, folks, I don't have the answers. I wish I did. I don't have the answers of what the solution is. But you know what? People cannot afford to even do preventive health care. And I'm going to tell you my story. When I was taking care of my husband, Matt, I was getting chest pain. I thought I was maybe having a heart attack, and there was nothing I could have done about it because my husband had to go to the hospital. So, of course, as most as many caregivers do, we put our self-care on the back burner because sometimes we have no other choice. This is the reality, folks. Sometimes the caregiver has no other choice. And so after my husband had passed away, which was January 1st this year, I decided I'm going to go for a stress test. I'm going to go to the cardiologist and see if he recommends a stress test. Heart disease runs in my family, very much so. My dad had heart disease. He had open heart surgery. My mom had open heart surgery. Before that, she had stents. My older brother had stents put in. My uncle died of a heart attack. My first cousin already had 2 heart attacks. And my other 2 female first cousins had heart valve replacements. So this is why I was concerned. And I know stress can cause heart problems, health and other health issues. So I went to the cardiologist, and I hadn't had a stress test done in probably, I forgot what it was, 4 or 5 years. So he recommended, based on my history, a nuclear stress test. And the insurance approved it. I called up about out of pocket. I was only expecting to pay like $1,200. And I had an echocardiogram done, which is, of course, extra. Well, folks, I already paid over $100 out of pocket for my echocardiogram. But the nuclear stress test, because they say the nuclear medicine is more advanced, much more expensive, which I'm sure it is. Well, my stress test bill was $3,462.96. Excuse me. That, folks, is out of pocket because I had to meet my $2,500 deductible, and they only pay half price of the imaging. So I was stunned when I received this bill. Someone suggested to me I call up the billing department and ask if they could lower it. So I did. And it was lowered to $2,000. So I called up again, and I said, can you lower it down any more? Excuse me. And I have to call back next week and see. Now, I just received this bill on a Thursday. They already have it in pre-collection. As I called up another number, she said, we're the third-party pre-collections. So I said, pre-collections? I just received this bill. How can it be in pre-collections already? So I told the woman that, if they reduce it down to $1,200, I will pay that with my stimulus check that we're getting here in the United States for the coronavirus pandemic. So there goes my stimulus check to pay a house bill. Now, this was preventive medicine, folks, in the event there was something wrong. Thank God there was nothing wrong with my heart. And I hope to God I never get sick because I can't afford it. And, preventive medicine, that is also a colonoscopy, which I'm long overdue for. Now, I called up this insurance to find out about coverage for a colonoscopy. It's 100% covered, but, and here's the little glitch, if you get a biopsy done, they go in, see a polyp, they biopsy it, it's considered surgery, and then you would pay 20%. And I said to the insurance representative, are you serious? Of course they're going to take a biopsy. That's what they're going in there for, to see if there's anything. And if there's anything, they do a biopsy. Oh, and yes, make sure that when you are there getting a colonoscopy, that it goes to the lab that is in the benefit. So there's only one lab that is in my benefit. So you also have to make sure that the place that you go to is in your benefit program, that it is covered. It is a Tier 1. They have Tier 1 and Tier 2. They pay more for the Tier 1, insurance does, but with Tier 2, you have to pay up front, and then when you meet your deductible, they'll pay half. So when you go to a doctor, I suggest that if you have the affordable health care plan, you ask what tier the doctor is in. Sometimes they don't even know themselves. Or you have to call up the insurance. And the insurance may say one thing, the doctor's office may say another. And I just don't know the answers, folks, but I'm just, stunned that it costs this much. And yes, I was spoiled when I had my husband's private insurance from his company, which we paid for. But when I had this done 4 or 5 years ago with the private insurance, I only paid 10%. And I thought that was a lot back then. I was shocked at the price of this bill. Getting preventive medical care to prevent health issues isn't affordable. If you were to become ill, that is not affordable. And folks, people say, oh yeah, save up for a rainy day. You know what, folks, I'm going to tell you this. You could save up for a rainy day, but if you have a catastrophic illness or your child, guess what? You're going to get wiped out. Easily, you're going to get wiped out. And then what do? I've known people who sell their houses because they had an illness or the child had an illness. Someone I worked with, she used to live out in Indiana, to get aid, to get help. It's not right. I don't know what the answer is. Maybe they need to think of, universal health care. But then again, in the other countries, like Canada or in Europe, they have the universal, but it has its flaws also. There's waiting lists to see a doctor. There's waiting lists for tests, for surgeries. I know that some Canadians come down to one of the states to get tests done or surgery because there's a waiting list. So universal health care also has its flaws also. So I don't know the solution. This show is a little rant about how I feel about the insurance system. The Affordable Health Care Act, the rates are high. Thankfully, I get a subsidy. I had to call up and get my premium lowered because I am out of work. My son is out of work due to the pandemic. And, of course, I have to show proof that my income is lowered. And I don't know if other people know this, but when you are on the I call it the Unaffordable Health Care Act, when you go do your taxes, if you made more than what you predicted, or the Affordable Health Care Act thinks that you made more or that you didn't pay enough, they will take away your refund right then and there when you do your taxes. You will get fined. And I was shocked to even know that when I started on this Affordable Health Care Act. And folks, many companies now, because of the price of insurance is so expensive, are telling their retirees, bye-bye, you're on your own. Now, my mom is very fortunate because she retired back in, I think, in 92 or 93, and her company still offered the health care insurance for her. That might be changing in the future. My husband's company sent a letter when my husband turned 65 saying, we're not carrying you anymore or your family. You are on your own, basically. So I lost my dental insurance, my health insurance. Matt was okay because he was already on Medicare, and I just had to find a supplement. My son was okay because he was on Medicare and has Medicaid. I'm the one that was hung out, left to dry. So I had to go on the Affordable Health Care plan. And I was in for a shock, folks. I went for CAT scans, MRIs on this insurance, x-rays. I had to pay half the price. If I go to a hospital, I have to pay 20%. The out-of-pocket expense is outrageous. And I was very spoiled with paying 10%. Thank God they pay 100% for the lab for now, if I go for lab work. My medicine is more money. And thankfully, I don't take that much medication, and it's not that expensive. But what do you do when your medicine does cost a lot of money and your insurance only pays but so much? I mean, there are coupons out there, there's incentives, but really what do you do? Folks, there's people in America and probably in other countries that you have to decide, are you going to eat or are you going to take your medicine? Are you going to pay this bill or are you going to take your medicine? I spoke to a nurse manager one time with my husband's old insurance company, and she was saying how people are non-compliant taking their medicine. And I said to the nurse, did you ever consider maybe it's not that they're being non-compliant, maybe they can't afford their medication, and so they have to decide, are they going to take their medication or are they going to pay a bill? Maybe they can't take the prescription like they are supposed to. Maybe they only take half of their pill because of the cost of the medicine. My boss told me that he can't afford a certain medication, and he doesn't take it. And this is a problem, because then if you can't take your medicine appropriately, like you should, then you're going to have problems. And there is, I guess, no easy solutions. Maybe they should have free enterprise and offer more insurance companies to enter the marketplace in New Jersey, ones that are less expensive, maybe ones that have better plans, because most of these insurances with the Affordable Health Care Act, their out-of-pocket is very high, and your expenses are high. I mean, it's just downright unaffordable. And, you know, what do you do when you don't have it? Now, the place that I go to for my CAT scan and MRIs, now you have to pay up front. You have to pay what you owe or what they think you might owe with the insurance, from the insurance company. They do an estimate, or they, you know, usually if you have to have a CAT scan or MRI, it's pre-authorized. And so you have to pay that up front before you can even get your CAT scan or MRI or X-ray. And if you don't have the money or a credit card, then guess what? You don't get your test done. This is outrageous. Needless to say, folks, the healthcare system is broken. Doctors will admit it. My cardiologist told me he spoke to an insurance company, and they referred to him as a healthcare provider. The doctor said, "I'm not a healthcare provider. I am a physician. You will address me as a doctor, or this conversation is over." They're not even looking at doctors as doctors, but healthcare providers as a business. It sort of is a business, but it's not. There's one healthcare company in New Jersey that are buying up hospitals, so it's becoming a big conglomerate, and doctors are not happy about it. It's not making the hospitals run any more efficiently. It's causing actually more problems. It's unreal, folks. The insurance companies, Medicare, are telling doctors what to do and what they can't do, what medicines to offer. My neurologist said to me, "Betsy, the insurance companies make so much money because they keep denying people medicine. They deny procedures. Doctors are spending more time fighting with the insurance companies and doing paperwork. People have been taking medicine for years. All of a sudden, the insurance company is saying, no, you can't take that. And then you have to appeal it. The doctor does, and the patient or the patient's representative. And it is time-consuming for the doctor. The doctors only have 15 minutes per patient, if that. And they're having more and more paperwork or computer work fighting with the insurance companies. The doctor that I go to, my endocrinologist, said that the insurance companies bully the doctors. The hospice doctor told me their hands are tied. They can't practice medicine like they would like to because there is criteria that has to be met. Medicare can take away payment if they don't follow criteria. And this is a problem, a huge problem, because someone in the insurance company who has no medical background is dictating to the doctors what is acceptable treatment and what isn't, what should be done and what shouldn't be done. This is not right, folks, at all. So that is my chat for today, and I want to thank you all for listening. I would like for you all to share this and read the blog that Jeanne White writes. She writes a beautiful blog, and it contains information. You can follow me on my own personal page, Betsy Wurzel, Wurzel. I have a group, #Kick Alzheimer's Ass Movement. You can join, even if you don't have a loved one with dementia. If you have dementia, any dementia, you are welcome. You can join to be educated. You don't even have to be a caregiver. If you want to be educated about dementia, please check us out. If you missed any of this audio cast, you can hear my show on Spreaker. Look up Chatting with Betsy. Have a nice day, folks. Folks, be an advocate for yourself and your loved one. And I want to suggest, if you get denied a procedure or a medication, fight for it. They hope you won't fight for it. Fight for it. Yes, it's time-consuming, but do it anyway. And that's what I have to say today, folks. Be safe. Stay home if you can. And be blessed. Till I talk to you again, this is Betsy Wurzel, host of Chatting with Betsy and Passionate World Talk Radio. Bye-bye now.